Good morning, everyone. We will get started in about 30 to 45 seconds. Welcome, everyone, and good morning. Again, good morning, everyone, and welcome. Welcome to the Louisiana Campaign for Tobacco-Free Livings Empower People Community Series. And today's topic is on community health workers impacting cancer prevention and tobacco prevention and control. Again, good morning, and we'll get started shortly. Again, good morning and welcome to today's webinar. Thank you for joining us today. We are here at Louisiana Campaigns for Tobacco-Free Living's Empowering People and Community series. The Louisiana Campaign for Tobacco-Free Living understands that an essential action of health equity is building the capacity of individuals and communities. Thus, TFL has developed the Empowering People Community Series, EPCS. This series consists of educational events, virtual and hybrid, coordinated by the TFL staff featuring stakeholders such as guest presenters and speakers from public health, policy, medical communities, community advocates, and subject matter experts to reach professional and community members from across Louisiana and beyond. The mission of the EPCS is to equitably bring health education, resources, and hope to people, populations, and communities in Louisiana. Our learning objectives for today is describing the role and responsibilities of community health workers in cancer prevention and early detection. Discuss how integrating community health workers into primary care teams can address social care gaps and improve population health management. And lastly, list ways of community health workers increase health equity for health center patients. Our moderator for today is Ms. Fiamla Bradley. She is the Northwest Louisiana Regional Manager for the Louisiana Campaign for Tobacco-Free Living, a program at the Louisiana Public Health Institute and the Louisiana Cancer Research Center. Fiamla has over 20 years of experience in the field of tobacco control, policy, and advocacy, coalition building, working with nonprofit organizations and marginalized communities. She is passionate about advocating on behalf of the undeserved, disfranchised, improving access to services and building community capacity. Fiamla works closely with communities to ensure that their hidden gems and unique stories are captured, shared, and used to inspire other communities to action. I'll now present to you Ms. Fiamla Bradley.
Thank you, Michelle, and great day, everyone. I'm delighted to be here. I do want to say that Daphne Galden, who was responsible for putting together this amazing presentation and these wonderful panelists, could not be with us today. And I was asked to serve as your moderator. So we certainly want to lift Daphne up as well as her family as she is away on an emergency. So today is a very special day as it is the kickoff for the National Community Health Workers Week. August the 25th through the 29th, we are excited to present this webinar today. And we're also excited to share with you an array of activities that will be happening throughout the week. So I would encourage you to either take a screenshot or use your camera to take a picture of those events. There's a kickoff webinar later today that I'm sure you will not want to miss. So we're going to pause for just a second so that you can capture that information and make sure that you take advantage of all of the wonderful activities that will be going on this week in recognition of National Community Health Week. While you're doing that, let me share this. Community health workers play a vital role in prevention by educating communities on healthy practices. by promoting lifestyle changes and connecting people to necessary health care services, thus improving public health outcomes and reducing disparities. Community health workers are trusted in their communities. They serve and they deeply connect local cultures, languages, and experiences. This cultural alignment, combined with the frontline status, allows community health workers to act as trusted liaisons between individuals and complex health and social systems. And all of this fosters better communication and increased access to care, along with improved outcomes. Let's get started. Today, we actually have three panelists slated. Charles A. Hayward, originally from New Orleans, Louisiana, has dedicated 27 years to working in social services and as a community health worker. He currently serves as a program coordinator for the Louisiana Community Health Outreach Network, where he provides statewide training for community health workers on core competency skills and capacity building. Additionally, he serves as the community organizers for Women with a Vision Incorporated. Mr. Hayward is an active member of the National Association of Community Health Workers and holds a position of chair for the Louisiana Community Health Worker State Board. Our next panelist we'll hear from is Renique Sylvie. Ms. Sylvie is the program manager of Louisiana Cancer Research Center's Office of Community Engagement. She holds a Bachelor of Science in Public Health from Dillard University, Master of Public Health in a concentration in Community Health Sciences from Tulane School of Public Health and Tropical Medicine, and a certificate in Community Outreach and Engagement. As program manager, Ms. Sylvie assists in the coordination of the COE-related activities across its component programs. These include the LCRC's existing cessation program, such as the Louisiana Campaign for Tobacco-Free Living, LSU's Louisiana Cancer Program, Louisiana Healthy Communities Coalition, LSU's Tobacco Cessation Initiative, and Southern University Ag's Community of Color Network, as well as a new community-centered activities that address cancers with increased incidence of mortality, cancer with disparate impacts on disadvantaged populations, and cancers that can be prevented or detected early. And certainly, last but not least, our panelist, Jaleese Griffith, is a clinical nurse manager and a certified breast health clinical navigator. With over 31 years of nursing experience and a strong background in oncology nurse navigation, Jaleese leads a dedicated team of registered nurses working to increase screening rates for breast, lung, cervical, and colorectal cancers across the state of Louisiana. She manages the Louisiana Nurse Navigation Assistance Program, a virtual patient navigation initiative under the Louisiana Cancer Prevention and Control Program at LSU Health New Orleans, which connects patients with timely cancer screenings, education, and support services, particularly in underserved communities. As a certified breast health care navigator, Jaleese brings deep expertise in patient education, care coordination, and advocacy, not only for breast health, but also for a broad spectrum of cancer-related and critical health concerns. Her leadership is grounded in clinical excellence, compassionate care, and a steadfast commitment to improving health outcomes through innovative and accessible patient-centered approaches. Panelists, thank you so much for joining us today. Was Mr. Haywood able to join?
Yeah, he's on.
Michelle, okay, great. Awesome. Well, Mr. Haywood, we will begin with you.
I'm sorry, Mr. Hayward. I think your sound is a little muffled. It's not clear. It's a little better.
Can you hear me now?
Yes.
Is that better?
Yes.
Okay, I apologize. My computer is just a little bit crazy today. I had an issue logging on. But just to give you guys like a brief overview of what LaShawn is, again, that's an acronym for the Louisiana Community Health Outreach Network. We are an association for community health and outreach workers, and our mission is to support community health workers by advocating for improvements in community health. The history of LaShawn. So we were established in 2010 by a group of community health workers and allies who wanted to create spaces for community health workers to be able to provide support for one another in the profession. At that point, we were just basically doing monthly meetings where community health workers within the New Orleans region would just come in and have a chance to network, share resources, and basically just kind of build on each other while doing the work. Since then, LaShawn has expanded and we do offer services statewide. We do monthly meetings and they're now virtual because we want to make sure that everyone can actually join in the meetings. So outside of doing the meetings, we are now fully staffed. At one point, it was just to host the networking opportunities, but now we actually have funded LaShawn staff, and we currently work with different organizations across the state, whether it's to help promote health events within their regions or their communities. We do provide community health worker training. That's an 80-hour training that's done. And for the most part, we've provided that training for most CHWs across the state of Louisiana. So we try to build up community health workers by giving them the education that they need, competency skills, as well as capacity building. And we've had the opportunity over the past few years to be able to partner with specific health goals within the community. So like right now, we are actually partnering with LCRC with their cancer prevention program. We've done a lupus awareness program where we actually offer training to community members. And I think we've done that twice now, just on the effects of lupus, what to look for, and just basically educating people, because a lot of people within the Black community aren't aware of what lupus is and how it affects us, and just what even to look for. So whenever we get the opportunity to provide additional education and partnering with people within the community, we're definitely on board for it. But overall, our main goal is just to uplift CHWs, keep them connected with each other, but also make sure that they have the connections that they need when it comes to working with healthcare professionals, how to work with healthcare professionals, and just being able to get out into the community to provide whatever preventative education that's needed.
Very good. Thank you. I heard you say that you do provide training for the community health workers, but the other thing I heard was that it sounds like you all, or you especially, you're available to perhaps speak to coalitions and other groups and really get the word out about the services that are provided and the importance of connecting with community health workers. So, you know, when people start to hear that there's a community health worker in town, maybe them being educated beforehand helps. Can you speak to that a little bit, and how perhaps maybe stakeholders or other individuals on the call may be able to help advance that work?
Yeah, so first off, I would like to say when it comes to CHW work, there are so many people who work as a CHW without even realizing that their work is falls under that umbrella. There are so many titles when it comes to peer education, community advocacy, case management, just being able to connect with clients, and people don't realize that it all falls under one big umbrella and a lot of things intersect. So I just want to speak on the importance of whether or not you don't have to have the CHW title to be a community health worker. If you are doing anything that provides resources, that educates people within the community about health disparities, preventative health, or just being able to make healthy choices to improve health, improve behaviors, all of that aligns with being a community health worker. I think it's important for people to realize that as a community health worker, support is needed. And it's good to be able to take advantage of the work that's being done. A lot of people aren't aware that community health workers are available, whether it's to come in and provide education, to participate in outreach events, to come and sit at a health fair, depending on what the topic is. There are basically CHWs that fall under different umbrellas when it comes to certain things, whether it's HIV education and prevention. Even when we were dealing with the pandemic, there were CHWs that would hire specifically to work on COVID education and making sure that the communities were safe. So yeah, I just think that people should take advantage of them, but also if you have the opportunity to link up with them, and if not, you can always reach out to LaShawn, because we definitely provide the information, that we have people across the state that are willing and able to actually work and come in as a community health worker to provide whatever services that are needed. We currently have open positions now, and that's another thing that people do when they take advantage of LaShawn, is that if there are job positions that are available, we have a huge listserv and a huge network. We have over 500 members, community health workers that are actively involved in LaShawn. So just being able to serve as a hub to make sure that the connections are made is extremely important, but we want people to actually take advantage of it. I know usually within this work, we kind of siloed. And even with today's topic being on cancer prevention and education, it's still siloed because it's specifically for that. But we do offer the opportunity for everyone to just come in and branch out no matter what you're doing, and just make those connections to be able to work together. CHW work, it's not always easy. And I just want stakeholders to know the importance of being supportive of them while taking advantage of the work that they can do. I'm not sure if I specifically answered that, because I felt like I rambled on, just going on and on about what what we do as a whole. So
No,
I'm
thank you.
sorry.
I appreciate that. No, you provided both clarity and you elevated the conversation. So thank you so much. And there were several things that you mentioned. So I'm sure you and your agency will probably be getting calls. So thank you, and I
Thank
appreciate
you.
that. And of course, there may be opportunities to answer additional questions if those on the call have some at a later point. So we appreciate all that you do. Thank you so much. And also thank you for the clarification on that big umbrella of community health workers, where oftentimes people are doing the work and don't even realize that that's what they are. So thank you for sharing that insight as well. We appreciate all that you do, and happy Community Health Worker Week. Our next panelist that we'll hear from now is Ms. Sylvia. I know that you have a PowerPoint presentation that you would like to share, and so we're turning it over to you at this time.
Hello, my name is Rainey Silv. I am the Office of Community Engagement Program Manager at the Louisiana Cancer Research Center, short for LCRC. Next slide. Through our partnership with the Louisiana Community Health Outreach Network, short for LaShawn, as Charles has mentioned, LCRC's Office of Community Engagement has hired 5 part-time community health workers that are located throughout the state of Louisiana. These CHWs are responsible for helping individuals and their families to navigate and access community cancer screening services, adopt healthy behaviors, and other resources. Below, we have LSRC's logo and LaShawn's logo. Next slide, please. Along with the CHWs, helping individuals and their families to navigate and access the community's cancer screenings, other resources to adopt healthy behaviors. The LCRC, CHWs also meet with clients and patients to establish positive and supportive relationships. CHW serve as a liaison to advocate between patients, providers, staff, and the community by facilitating a communication and coordinating services. CHWs also refer clients, patients to clinics, a community of resources, and other agencies to meet identified health needs. These clients are typically consist of the FQHCs and other local nonprofits. Next slide, please. The LCRC community health workers are located in the following regions. We have a Region 1 who serves the greater New Orleans area, Region 2 who serves the Baton Rouge area, Region 3 who serves the Patterson and Morgan City area, and we have a Region 8 who serves the Monroe area. The next slide, please. The LCRC Office of Community Engagement has collaborated with the Louisiana Cancer Prevention and Controls Program, LCP, for the LCRC community health workers to utilize its online QR code of referral system. The goal for this project is to initiate partnerships with the community organizations, providing the navigation services to underserved people to implement education on cancer screening services and clinical trials. The CHWs are the front runners for this project. Their role is to engage with a potential participants at community events to identify and to register eligible participants who would benefit from the LCP online QR code of referral system. On this slide, we have the LCRC's logo and the LCP logo. Next slide, please. Each week, the CHWs attend a wide range of events across the state to raise cancer awareness and encourage individuals to register for screening through the online QR code of referral system. These are types of events covered are health fairs, academics, academic seminars, cultural events, and seasonal gatherings. The purpose of the participation is to raise awareness, educate the communities on the importance of screening and also research opportunities. The goal of this is to increase early detection, expand access to cancer screening statewide, and at the bottom we have pictures of the community health workers at these events. Next slide, please. I've included my information here for more. I've included my information in case anybody wants to reach out and to find out more stuff. Also, I will provide my information in the chat below. Thank you.
Thank you so much. What I heard you share, and you also had a map, there were specific areas across the state of Louisiana where at this time those community health workers are working in communities. Can you share a little bit about how, and I think I kind of alluded to this with our previous panelist, how organizations, individuals, perhaps, even faith-based community organizations can be a part of the work, can perhaps recommend places and people that they can go and talk to. How does that work, and how can those people in listening can get involved and can help perhaps make referrals or make suggestions of places where these community health workers can go?
Yes, essentially, I am the person that essentially goes and mark those spots. So if anybody has any additional information or or would like to have a partnership in the future, I'm the person to reach out. Also, I could provide a list of the contact information of the community health workers, since they are located throughout different states. So I hope that I answered the question, but essentially essentially I am the point of contact.
Okay, thank you. And you did. Thank you very
Yes.
much. And our final panelist, Ms. Griffith, is a part of the Louisiana Nurse Navigation Assistance, which is a centralized virtual patient navigation program. And so at this time, she's going to provide us with an overview and how it works and give us some program highlights. So now I'm going to turn it over to you, Ms. Jaleese Griffith.
Hi, good morning. I want to say thank you to the Louisiana Campaign for Tobacco-Free Living for this opportunity to talk a little bit more about our program. I am Jaleese, and the program is very new, and I'll discuss that a little bit later in the slides. And thank you for your attention. The Louisiana Cancer Prevention and Control Program focuses on reducing cancer-related illness and death across the state by emphasizing prevention and early detection. Our efforts primarily target breast, cervical, HPV-related, colorectal, lung, and tobacco-related cancers, ensuring timely interventions where they are most effective in improving patient outcomes. Promoting adherence to cancer screenings requires a coordinated effort to ensure patients complete recommended tests, such as mammograms, pap smears, HPV vaccinations, low-dose CT scans for lung cancer screening, colonoscopies, and/or stool-based screenings on schedule and as part of their routine preventative care. To help improve cancer screening rates, LCP developed a virtual navigation program to raise community awareness and support federally qualified health centers with evidence-based interventions. What I'll say about that, that portion of our program where we support FQHCs is a bit on hold. It's related to grant funding and whether or not that portion of the program will be refunded. So just in the air full transparency, that portion of the program is on hold. Next slide, please. Okay, this is maps of cancer incidents in Louisiana as well as across the nation. For Louisiana, and this data is one back. Okay, thank you. Okay, so on the left side, this is obviously a map of the state. The cancer incidence, and this is across all cancers, not just screenable cancers, but the incident rate is 483.6 per 100,000. These numbers are from 2017 through, I believe, 2022. As you can see, that translates into a raw number of actual cancer diagnoses of 28,580,000 people are estimated to be diagnosed with cancer in general across the state yearly. As compared to, you look at the national rate and where Louisiana ranks amongst other states. As you can see, where we are here in the South, we are the highest ranked state in terms of cancer diagnosis. At the bottom left, this is the mortality rate, so the death rate. Louisiana, we rank one of the highest across the nation. Currently, the incident rate is 168.6 per 100,000 residents. The death rate is about 9,300 people per year die from cancer-related illnesses. On the right bottom is that map for the state, and you can see where Louisiana aligns with the rest of the nation. Next slides. Okay. Yeah, that's it. Okay. So the screening gap, cancer cases that could be prevented or diagnosed early. These are cancers that are screenable before their issues arise. So before someone is symptomatic or feels alone or have some illness, these are cancers that can be screened before that happens, because it then is no longer screening. It then becomes diagnostic because you have an actual problem that needs to be investigated. So as far as breast cancer, obviously breast cancer is screened using mammograms. In Louisiana, approximately 71% of eligible women are getting screened. The national average is 78%. For cervical cancer, with the Pap test, 75% of eligible women are getting screened. Nationally, that's 85%. For colorectal cancers, and that's either through colonoscopy or stool-based tests such as a FIT test, 66% of adults age 50 to 75% are actually getting screened. Obviously, the U.S. Preventive Services Task Force recommend that adults of average risk start getting screened for colorectal cancer at 45. The national average is at 72%. For lung cancer, using low-dose CT scans, and then, I apologize, these numbers are actually a little bit better. I need to update the slide. So right now, Louisiana is screening about 15% of high-risk adults, and nationally, that average is between 16 and 18%. On the right-hand side, this bar graph shows the estimated number of cancer deaths in the U.S. and then the lower right in Louisiana. So this is for 2025. So this is an estimate. As you can see, for lung cancer, the national estimate is over 106,000 people will be diagnosed with lung cancer. For colorectal cancer, it's about 29,000. For breast cancer, 35,000, and for cervical cancer, 3,600. In Louisiana, for lung, that's around 2,400 people will die from lung cancer. For colorectal cancer, it's around 400 people. Breast cancer, about 250, and for cervical, 125 deaths. That is a projected 3,375 preventable deaths per year, just in Louisiana alone. Next slide. Okay, so I'm talking to you a little about LANA, which is a new name. We've been calling it the Central Patient Navigation Program for months. We finally have decided on a name, which is LANA, which stands for Louisiana Nurse Navigation Assistance. In October, program began in October of 2024. Louisiana Cancer Prevention and Control Program launched this virtual patient navigation program by hiring 2 registered nurse navigators to increase cancer screening rates throughout the community through a collaboration with the Louisiana Cancer Research Center's Office of Community Engagement to hire community health workers to increase community engagement, increase awareness, providing education, and also engage community members to refer them to us for eligible screenings. Next slide. Okay. I think it's one back. Okay. Okay. I can pull up my slides. I can tell you where. So the slide after the one I just spoke about is that one. Yes, thank you. Okay, so the Virtual Patient Navigation Program. So LPC's Virtual Navigation Program, LANA, enhances care coordination and improves patient access to screenings by using telecommunication to connect with providers, patients, and testing. So we don't actually see individuals in person, but we can communicate with them through email, through text messaging. Obviously, we can contact them directly. So it's really their preference. However they want to be communicated with is how we communicate with them. Next slide. Okay, yeah, this is it. Okay, what sets LANA apart? LANA is a patient navigation program housed within an academic setting designed to serve underserved communities across Louisiana. Our purpose is to ensure that every individual, regardless of geography, income, or background, has access to timely, equitable, and appropriate cancer screenings. I didn't mention this in the beginning, but we are, Louisiana Cancer Prevention and Control Program is housed at LSU Health. We are within the School of Public Health here at LSU. What we do, we are a community-centered navigation program. We work virtually with individuals to guide them through screening, diagnosis, treatment, and survivorship. We work to help overcome challenges such as transportation, insurance, language access, and also appointment coordination. We work hand in hand with local community organizations, healthcare providers, and healthcare facilities to build trust, expand our reach, and assist with cancer screening appointments. How we're different. We have a statewide reach with a local approach. So unlike many programs that focus on single institutions or cities, Lana operates across Louisiana, adapting to the unique needs of each community. As you know, what individuals need in rural communities isn't always the same as someone needs in an urban area. Lots of times it's access to care that they can actually get to. Sometimes they have to drive a long distance in order to get to, certain types of health care, and we can assist with that. Obviously we can't move institutions close to them, but we can provide them with transportation assistance if that becomes a barrier. Or if they have no idea where to go, we can also navigate them through that process. Academic integration. As part of an academic institution, the program is able to leverage research, data, and clinical expertise, which allows us to integrate evidence-based practices, train future navigators, and evaluate our impact. We are an equity-driven model. We prioritize populations that face the greatest disparities in cancer outcomes and tailor our approach to meet their specific needs. So whether someone is uninsured or even underinsured, because you can have insurance but still not be able to afford the care because of the deductible or co-payments, we can assist with that as well. We're aiming to build sustainable partnerships. We don't want to just refer patients. We want to build lasting relationships with community organizations to create a seamless support network. Next slide. Yes, yeah, okay. Community health workers, community support. So this is where we partner with LCRC. So the community health workers are engaged as trusted bridges between the nurse navigators and the community to increase cancer screening rates. Their role includes providing information and advocacy to improve access to care and healthcare outcomes. They attend, as has previously been mentioned, they attend community events to share information about cancer screenings. They also then refer individuals who may be eligible or who are interested in getting education or referrals to have their cancer screenings done. We can be contacted by an online referral form, which I will show in the coming slides. They can scan a QR code, which opens to our referral form, and also, or they can call us on the toll line. Next slide. Okay. On the left this is the front and back of a business size card. On the back of the card, that is our QR code. When you scan that QR code, and on the next slide, we'll show what the form looks like. And on the on the right is a copy of our flyer, which also needs to be updated. I need to add Atlanta to that slide. To the flyer. Next slide. This is the referral form. So either once the QR code is scanned, or you go to our website and click on the referral form. This is the referral form that populates. So it asks basic questions, like who's referring you? Were you referred by a community health worker, or you're referring yourself? And obviously, if someone is referred via the toll line, they have actually called into us on the toll line, and the nurse navigators will select that button. Obviously, their date of birth, language preference, their demographic information, their name, date of birth. Are they insured? Are they having any symptoms? What cancer screenings they're interested in or think that they may be eligible for? The nurse navigators will, contact those people and have a further discussion. Next slide. Okay. This is at the bottom. This is our work process map. Once the referrals are received into the virtual navigation program, like I mentioned, the nurse navigator follows up with the individual to assess their interests and their eligibility for different types of screenings. They will connect them with a primary care provider if they don't have one, because more often than not, that's where screening begins. For a lot of this screening test, people need a physician's order. So if they don't have a physician, we connect them with a primary care provider. It depends on where they're located in terms of mammograms, because I'm here in New Orleans at a University Medical Center. If you're not having any breast symptoms, you can actually self-refer for a mammogram. Address and work with to eliminate any barriers. So whatever it is, if it's transportation, if financial need, we can also help eliminate those barriers as well. And also conduct follow-up calls, confirm the screenings are actually completed. So it's one thing to have people call and we assist them, we navigate them to the service, but we need to know that they actually are getting the screenings complete. So we're actually working on more of a process to be able to query that data so that we know where we are. And at the bottom, like I said, this is just the work process map that I just described. Next slide. Okay, progress so far, this is as of July of this year. Community support, we've received 83 referrals. That has led to 243 individual encounters. And that's because that lots of times there are follow-up calls that are required. So that's why that number is larger. Next slide. Just to mention some key takeaways, Louisiana consistently falls below the national average in screening rates for major cancers. Rural and underserved populations have significantly lower screening rates. Community-based navigation programs like LANA are critical to improving these numbers. Studies have shown that patient navigation interventions are demonstrably effective in increasing cancer screening rates, particularly among underserved populations. Navigation services go beyond just information. They offer tailored support to navigate the complexities of the healthcare system, overcome logistical barriers, address psychosocial needs, reduce disparities in care, improve patient satisfaction, ultimately leading to a better quality of life. Next slide. And that's just my contact information, as well as the program's contact information for Louisiana Cancer Prevention and Control Program, and our physical address. And the next slide is just my references. Thank you all.
Ms. Griffith, thank you so much. You have provided us with a wealth of information and certainly an even greater appreciation and understanding for what the Louisiana Nurse Navigation Assistance program does. The word navigation is what stands out to me. I am again, just thank you so much. And also thank you and congratulations on your outcomes for sharing those with us. We know that in all of our programs, those markers are so important and really speak volume to the individuals that we're serving and those who are actually taking advantages of the services and how they're benefiting from them. So thank you so much for sharing. You know
the impact,
Yes, absolutely. That's the word. The key word is impact. Yeah. When I listened at all of our presenters over the years, and even most recently, two very popular sayings, if you will, just kind of rang out. One is we are better together. We certainly cannot do this work in silos. We certainly have to collaborate and work together. And the other one, I know you all are familiar with hearing this one, boots on the ground. So that's what we all are. That's what the community health workers are. And so again, as we are all boots on the ground, we are better together and can continue to look at ways to collaborate and to do that. Quickly, I will share one way, Ms. Sylv, when she talked about how she coordinates the various programs through under the guidance of LCRC, she mentioned the Louisiana Campaign for Tobacco-Free Living. And so I'll share just a little bit on how we have been able to successfully navigate, be boots on the ground, and to work across the state of Louisiana to make a significant impact. What we know is that smoking rates in communities with low socioeconomic status are roughly 24% compared to 15% in general populations, if you're looking at it from across the United States. Many people face barriers in receiving cessation services and treatment. But what we also know is that studies have shown that even brief advice from physicians and community health workers are successful in helping people quit. And I'll give you one example of how we've been successful in partnering, because all of the work, and as we were listening to all of you, we are all working to achieve our goals through a collective impact lens. And the way we've been able to successfully do that, or one example, is that our resource guide, our resource material for cessation, we've been able to partner with AmeriHealth Caritas. And if many of you are familiar with AmeriHealth Caritas in Louisiana, they have a mobile bus that travels throughout the state of Louisiana, providing education about their program, but also they also serve as a connector to other services. And as we have partnered with them, they also have in both Shreveport and New Orleans a community health center that's open to the public, where lots of education takes place, where people can come, they can exercise, they can learn about how to connect the dots in the community as it relates to services. And it's a great both partnering and collaborative space. And so as we partner with them, we have been able to utilize their bus that travels across the state of Louisiana and provide cessation education in places and spaces that we are all not always available to be there. And so we're actually, as the old saying, killing two birds with one stone. We're providing those individuals that they come in contact with, a one-pager that provides at a glance, resource information, the services, as well as the qualifications. And so that those cessation services offer care for individuals ages 13 and up. So not only are people able to call something as simple as a 1-800 number to receive services, there is also a vaping component of Live Vape Free, where they can actually text vape free to 873373. And they can also utilize the Louisiana Tobacco Control Initiative information. And so know that you will be receiving at the end of the presentation that particular one-page resource guide so that you can share that in your community as well. The reason I shared that particular collaboration and the reason it's so important is that we are boots on the ground, but we can't be every place at the same time. So this is a way to think out of the box and think about who the community partners are in your respective areas and how you can partner with other agencies to make sure that the great work that you're doing and the impact that you're having can be amplified across the state of Louisiana. At this time, Michelle, if you would take a look in the chat and see if we have any questions, we certainly would like to tap into the expertise of our panelists if we do. Do we have any questions, Michelle, or comments?
Looks like we have one comment in the Q&A. There's nothing in the chat. And it says, yes, so thankful for the work CHWs do in the community.
Awesome, and I can certainly echo that. I would also like to, and please, if there are any comments in the chat or questions, you still have an opportunity to go ahead and enter those. We will check again. In the meantime, while we're waiting to see if any other comments are made, I would like to just give both Ms. Griffith and Ms. Silva an opportunity, if there are any closing remarks or comments or anything that you would like to say to those individuals that are on the call. And again, any ways that you can perhaps encourage them to become more active in the process of the great work that you're doing to help amplify that work in the community. And we will start with Ms. Silva.
I'm sorry, I was trying to read the question in the chat. Ultimately, I would say I've been trying to add my information in the chat, but I don't see an option to. But ultimately, if anybody would like to partner or collab or have any upcoming events that they think that any of the community health workers that LCRC has would like to attend or be a part of, please reach out to me. I will try to put my information in the chat once I see the option to, but I'm not sure if I answered the other question of
That's fine. And what we will do, Ms. Silva, we will make
Mhm.
sure that panelist information and contact information, with your permission, we'll certainly make sure that that's available to
Mhm.
everyone. I also see Ms. Griffith has added her contact information, but we'll certainly make sure that all of our panelists' information is available, as well as on any presentation information also. So thank you. Ms. Griffith, what would you like to share in your parting comments?
Yeah, I just want to say, look, share our information about our program far and wide. We're here, we're available to assist people statewide, especially in rural communities. And if we encounter someone who calls us and it's a new situation for us, we'll work through it. We're nurses, we will figure it out. So there's no such thing as someone calls us and we can't find some sort of resolution. So that's the most important thing we want. Is a very new program. We want to, obviously make it a robust program. We know that the need is out there. We just need, your assistance in reaching those people who actually need our services. So I'm going to actually try to add the flyer to the chat with additional contact information on, and just also the flyer also contains eligibility criteria. So all of that's on the flyer. So if someone thinks they may be eligible, they can basically use the flyer as a reference for their possibility of the eligibility. But that's what I ask. Just spread the word.
Also,
Thank you.
also, Charles, they would like your contact information if you wouldn't mind putting your information in the chat. That was two questions that came up as well.
Absolutely. Last but certainly not least, Mr. Haywood, we were coming over to you. And so while you're putting that contact information in the chat, again, any parting words, anything that you can say to those individuals that are on, that can certainly encourage them, or give them any suggestions on how they can become involved or continue to stay involved.
I'm sorry, Mr. Hayward. I think your sound is muffled again. I know it worked and now it's back out again. It's a little bit better.
Just for the work that you're doing in general. I feel like you're underappreciated because I know that CHW work is long, it's hard, and you have to give so much of yourselves to make sure that you are actually helping the community. And a lot of times we put ourselves on the back burner. So I just want to say thank you, let you know that you appreciate it, but also stress the importance of self-care. Remember, just as much as you're taking care of others, you have to take care of yourself as well. I'm going to put my information into the chat. As it was stated before, I am the chair for the Louisiana State Board of CHWs, and we do have one more in-person meeting that's going to be happening later this year during the fall. That meeting is open to everyone. You wouldn't be able to vote, but you're actually able to come in and listen to the topics and even share your thoughts on what we're speaking on. So I'll put my information in the chat, and if you guys need any type of support, any help with anything, by all means, please let me know.
Thank you so much. And again, I just simply want to say happy Community Health Week. You deserve it. You all are doing amazing work individually and collectively and collaboratively. And I'm seeing the hearts pop up on the screen. So they're sending you lots of love right now. Thank you so very much. As we wrap up, I do want to remind you that several things that you will receive from us is the resources, services, and qualification one pager from created by the Louisiana Campaign for Tobacco-Free Living. Also, there is a one pager with information about the National Community Health Awareness Week. And so you'll receive those in addition to, we'll also add the contact information for the regional managers for the Louisiana Campaign for Tobacco-Free Living. And so again, continue to do the great work that you're doing. We are not operating in silos. We are definitely boots on the ground. All of our boots are touching the dirt. And at the end of the day, we are all better together. So thank you again so much. And now I'm going to turn it over to Michelle.
Thank you, Fiamla, and thank you to our panelists for speaking today on this very important topic. And again, happy National Community Health Workers Week. Just a few housekeeping things at the end of this webinar. We are asking that everyone please answer our surveys. Please let us know any feedback of what we should improve, or if how you liked it or didn't like it, or if there's any topics that you want us to expand on, or if there's a part 2 that needs to be done on the community health workers. Again, thank you all for being part of today's webinar, and you all have a good rest of your day.